We're excited to be here today. We're with one of our hygienists, Kristin, who we'll introduce in a moment. In looking at how we connect with everybody and what we do, we're always trying to make sure that we can go to you where you are and give you something really actionable and interesting to help take the greatest care of yourself and keep you at the highest baseline level of health.
We're doing this a little different. Rob and I are on the same side of the table because we have Kristin with us today. We want to talk about what makes our hygiene appointment special, what we do to help our patients take better care of themselves.
Mark and I spend so much time in our practice for our patients with the hygiene, everything, the hygiene appointment, the role of our hygienist, and what we offer our patients in the hygiene experience, because that's the foundation of their health, right? That's the foundation of your health, is how do we maintain and keep your teeth in your head, keep your gums healthy. So Kristin, what do you view your role with our patients? What are the top few things that you try to check the boxes on when you meet a patient, work with a patient over the course of your relationship with them?
Yes. So I love to educate my patients. I love to teach them, and they want to learn. The patients that come in, they want the information. So I want to be able to be well educated on my role to be able to give to them what they need. I just feel it's so important. I have a short period of time with them, and I need to just educate them on flossing and on brushing and really just focusing on good health for them and getting their mouth in a really healthy situation.
That's great. And have they been responding to that?
They enjoy it. I mean, I have some great response with patients, and the patients today are very up on health of the whole body, and they know from what we teach them that it starts with the mouth.
So Kristin, what would you say are the top few things you try to get across, or your goals with your patients?
My goals with my patients is to educate them, to empower them to become good dental hygiene patients. It's getting their mouth into a healthy state and keeping their systemic health over time. And prevention.
So it's not just about cleaning their teeth.
It's not just about going in there and scaling teeth. It's about a whole body experience with them and teaching.
So the foundation of hygiene, maybe touch upon what are you actually doing on those patients to get them healthier? Just the bulk of your work.
Okay, bulk of my work is, of course, taking x-rays and reviewing x-rays, going in and evaluating the soft tissue, evaluating the hard tissue, measuring pocket depths. We check for inflammation. Inflammation is very important for us. It's the bleeding, see if there's bleeding on probing, and we check to make sure where the tartar is and make sure we remove it. Right, and set up situations that we can remove it, whether it be one visit or two visits.
Double click on that a bit, because you exist because a patient could not achieve the same result on their own, right? So if you were to floss every day and brush, for the average patient, it wouldn't be enough. Why? What are you doing that's different than what they're doing?
So I need to get under the gum pocket. A patient can never, even if they're great flossers and great brushers, they could not get down to a base of a pocket. We need to get that bacteria out from the base of that pocket. And if they have that tartar there, and once it calcifies and it gets hard into calculus, we need to scrape that out because that's all bacteria.
And you've been seeing results, getting patients back on recalls.
Yes.
I know some are on 3-month recalls or 6-month recalls. Describe why some patients are seeing more than others.
Years ago, it used to be 6 months and everyone would be on a 6-month. Today, most of our patients are on a 4-month schedule. And we find over time that it works so much better. 3 cleanings a year. It's just more about body maintenance. It's prevention and maintenance.
That brings into the medical part of it. It's not all about them not doing a proper hygiene cleaning at home. Right? Some people still accumulate more tartar.
Everyone's mouth is different, and we have to assess each patient differently. You're not going to build up the same amount of tartar as you are, so we need to know the baseline of the patient, and we need to direct them where we're going to bring that patient.
Yeah, and Robin, that brings us back to the correlation with maybe cardiovascular disease, with plaque buildup and so forth, while we look at the overall health of the patient.
It's really important that people are mindful and realize that there are a few factors to take in mind. Number one is someone's own microbiome, their saliva, and how much plaque and tartar and calculus they generate. Because this is something that no matter how hard you work, no matter how diligent you are, there's a percentage of patients that accumulate calculus at a rate that will promote inflammation in their mouth. Yes. So that's why Kristin has a job, right? That's why we have a team of great dental hygienists, because there's a level of hygiene delivered by a hygienist that is a person is incapable of doing themselves, right? That's primary. And then that leads to inflammation, secondarily, their own susceptibility to disease and inflammation. So we're doing a thing where we do saliva tests. I have a patient who is the most diligent person possible. He's amazing. He comes in every 6 months and he's near spotless. But we did some testing on him, and he has a moderate level of susceptibility to inflammation systemically and in his mouth. So although he is so diligent,
he's got a precursor.
He's ramping up his hygiene appointments to come in every 4 months because he wants to maintain the highest baseline of health and the least amount of inflammation possible.
Inflammation is very important for the whole body as well. So you want to start from the mouth. You want to keep the inflammation down in the mouth, and it'll help for the rest of the body as well.
So you started out by saying one of the most important things that you do is to educate and empower your patients. What are a few things that you wish patients knew?
I wish patients knew how it is to feel to have a healthy mouth, to wake up and to be able to brush and floss and have a nice fresh breath, and to really not have any inflammation, no bleeding on brushing and flossing. And it's a good feel. It's a good feel for the mouth. Some patients go, but my gums always bleed. And I go, no, your gum's not supposed to bleed. But they just feel that it's always been that way, and they feel it should be. And I love to educate them. And then when I get them to the point, like, I don't have any blood in the morning, I'm like, oh, that's wonderful. We're getting there. We're moving. We're moving in the right direction.
It's nice to see the results.
It is nice. It's really nice. It's a small thing, but it's very important for us.
What's one of the top mistakes that patients make?
Not flossing correctly. You know, sometimes they'll use the floss picks and they just pop through, but they need to wrap that floss around the tooth. So they don't really wrap the floss around the tooth as much. And they don't touch with their brush. They don't brush as long, and they don't touch the gum line. They'll do quick, but they don't get around by the gum line because that's where the plaque lays, right around.
So you're spending time educating the patient during the visit?
How to do it. And it sounds so basic and something you've learned as a child, but you just don't do it correctly.
Would you say that what's more important, the technique that they're using or the product that they're using?
I would say technique. And I would say technique because you can use several products, but if you're not touching the gum tissue, if you're not getting deep enough, if you're not doing a proper pressure, then it's not going to work.
So would you say some of your patients are using different products than others?
Right. There's so many products that are out on the market today. So all of them are great. The electric toothbrushes are amazing that are out on the market, but they still need to use them properly.
It goes back to the technique.
Yeah, I think it's about treating and preventing, right? The role that we see you having with our patients is forming this foundation of extreme health, really great health, by keeping the inflammation almost out of their mouth completely, together with Kristin as a team approach, with the patient being an equal teammate, if not more important.
So if you look at it, the education is for a lifetime, right? Or at least for the next 4 months when you get them back. The cleaning that you do is only good to their next meal. So if they're not doing their home care at home.
Right. And also with 4 months, and then they come back and they go like, I kind of fell off the bandwagon about a month ago. So but they come back for their 4 month and we get them right back on track, and they walk out and they go, wow, that was a really good cleaning. It feels so good to have a nice health.
What else are we doing, or what are you doing differently moving into the future to help educate your patient?
We have some nice things coming on down the road with dentistry. We have some really good things. I'm just loving being here with such great dentists, and they really help me, inspire me to do some good things. So we've been using a new AI called Grin, and that's been wonderful. And the patients love it because they get to see what their mouth looks like, and they can show it to other people. It's just kind of a fun thing, and we can keep record of them with the mouth.
Describe how that works with the Grin.
So the Grin is very easy to do. We just basically take a video of our patients, and they're able to see what their positioning of their teeth are today. And then Grin went a little bit further with some AI, and they're charting the patient with some plaque and some disease.
So you could take a scan in the future and compare the results and show it to the patient and show them where they're missing or where they're doing a good job or not.
And it does show inflammation of the gum tissue as well. It's nice. And it's just, picture shows 1,000 words. We can tell a patient about inflammation, but for them to see it, they're like, wow, that's great. That's amazing. Look at that. Yeah. And they just love to have it on their phone because then they can share it with somebody else. And they just say, wow, look at this.
Rob, we were talking about, we have some future AI coming in, which I think we could spend time in the future talking about, maybe not now, which is really going to help us with our digital x-rays and so forth.
We're trying a few different companies. There's some AI companies that are working on radiographs, right? In medicine, as we talked about in last month's AI talk, is that AI is really moving into healthcare. First, it primarily is reading two-dimensional images, right? So Grin takes a video, turns into two-dimensional images and reads the actual photographs. We're also trying out a couple of the AI companies that focus on radiographs. Again, or the standard radiograph that we take is a two-dimensional image of a three-dimensional object. And so we're right now testing out a few of the different programs to see how we can educate our patients. But more importantly, we don't want to miss anything. Part of the reason why we spend so much time with Kristin and our team of hygienists is to make sure that we're getting a great baseline of health, but also we're not missing anything for anyone. Because it's not that we want to find it, of course, we don't want to find it, we just don't want to miss it. So the advent of these technologies will help assist us to look a little different, to see things we may not see with our own eyes, and to prevent missing things. Because that's really our goal, is to find things when they're smaller. That's the great point of what the patients who come in regularly, right? So we have patients who hardly ever miss their 3, 4, or 6 month hygiene appointment. We have plenty that life gets in the way and misses it. I can tell you that over the course of decades of taking care of patients, the one that keep up with their appointments, we're able to minimize disease, but also find it when it's smaller and treat it when it's smaller. So the treatment is less, the complications are less, and the consequence of what happens in your mouth over your lifetime is less, because it's the trajectory over time, right? We treat something smaller today. Well, in 20 years, the byproduct when that thing fails will be less.
I think that's smart what you said, finding it when it's small.
That's right. So it doesn't turn into a root canal. It doesn't turn into a larger restoration.
And with the assistance of AI, that's going to give us assistance to help read our radiographs to help prevent that.
It's another set of eyes.
It's why you would keep up your appointments with your dermatologist regularly, right? It's why you go for certain intervals for colonoscopies. Just try to find things before they become problems.
Exactly, right.
That's why these intervals exist.
And that's why your cardiologist will do a chest x-ray. You'll have no symptoms, but they'll still periodically do that, which brings us into our radiographs.
Yeah.
You know, a lot of times we get a little pullback on patients taking x-rays, and we really can't do our job properly without a full set of x-rays to really help diagnose the patient.
It's like second guessing.
And it's helping you also, right? How are the x-rays helping you when you...
I love comparing x-rays. I love to be able to look back on an old x-ray and say, okay, like we'll sit in the room together and we'll like, all right, let's pull up the old x-ray. Let's see what was
For
there.
progress and change.
That is wonderful. And AI will be great with that. They'll be able to look back and they'll be able to look forward and say, wow, that we were looking at an x-ray yesterday for a patient and it looked like there was a shadow there, but that was exactly, we looked back on every single x-ray that we had on the patient. It was exactly the same. And then we found a couple other things as we were looking there.
So it's educating yourself and the patient at the same time. It's making your
I'm
job.
so excited with it. I just think it's going to be a nice thing for me to learn down the road.
I think what happens is that there are two things that exist in our life, everywhere we go and everything that we do, that are scary because it's invisible, right? Microwaves and radiographs are something that is common things in our life, and yet it could be scary. Don't stand next to the microwave. Microwaves are almost like sound waves, right? It's almost impossible for it to be a harmful thing. Now, if you're microwaving plastic, that's a different story. A lot of press right now about that, so don't microwave plastic. But I noticed that patients will say to us, I don't like radiation.
Or
I don't.
just had an x-ray with my doctor. And
So what we have, and we'll put it on the link of this email, and I think it's so important, is to quantify things, quantify what you're scared of. So it's not an emotion, it's actually an intellectual decision. In research, there's such a thing that's called the banana equivalent dose. And what the attempt of this is, and you could Google it, we'll put a link on some paper.
There is a form of radiation in a banana.
There's in the potassium in bananas does give you a form of radiation, which you do digest through and excrete out. So it's not cumulative radiation, but still, there is a certain amount of radiation in one banana. And so it's good to say the amount of radiation in one banana is equivalent to the amount of radiation in one radiograph.
Dental X-ray. Dental X-ray. Yeah.
One dental X-ray has the equivalent of one banana. And what we're trying to do is quantify something that's invisible and scary, and it can be mishandled. So what I think that what our patients should do is, if they're having x-rays beyond the dental office, so if you're having medical grade x-rays, CT scans, you could actually find out from your doctor when you're there getting the scan, how much radiation is this machine emitting me for this exact scan.
So you can help figure out how much you're exposed to for the entire year.
Look, last year I had a repeat of a CTA, right? CT angiogram, and that's looking at calcification plaques in the blood vessels of the heart. So with my physician, my cardiologist, I'm talking with them and saying, well, we have to go get this done. Where should we go? And she specifically said, the machine that exists, that's 20 millisieverts and 2 millisieverts, right? There's a huge difference on the machine. So by knowing what you're being exposed to can really cumulatively help your feelings and assessment to be actually a quantifiable intellectual decision based on what you should do actionably.
Millisieverts is what we use to measure the radiographs. That's the dosage, and the yearly requirement is 50 per year.
That's the requirement, the yearly threshold.
The threshold. I mean, you don't want to have more than that. A medical CT scan that you said you had the option of 2 or
20.
20.
Yeah, depending on the and that had to do with the quality of the machine, the when the machine was made, the technology, and how the scan was executed. So we in our office have exactly measurable amounts for everything that we do. There's nothing that we do that's even one millisievert.
If you look at a full series of X-rays, it's a 0.08, I think.
Yeah, 0.08.
The comparison I like is they show a flight from New York to California is 0.04. So if you did the round trip, it would be 0.04. So a round trip would be 0.08. So it's roughly the same as a series of dental X-rays. And that's usually the most exposure that we do. Even if we do, we have a CT scan, a computed tomography in our office, and it's a cone beam, so it's a smaller
different type of CT
than a CT scan.
The medical grade.
I did the measurements, and it's about 67 times less than a normal CAT scan.
Yeah,
and that's the most we would do in our office, and that's.
It's only 15 tenths of 1 millisievert, 15 tenths of 1 millisievert for the highest dosing that we do in our office. So we are here to empower our patients, right, Chris? But and we're also here to represent you. So we don't have an emotional feeling if you do not want to take X-rays. That's something you can decide. You're here to make a decision on how you want to be taken care of. We are representative of you. We're working for you when you're in our chair. We don't have a feeling about it. We would like to do the best for you, and that would mean that we wouldn't miss things. So first off, we support you not taking radiographs if you choose not to. Just understand the consequences. The consequences is that you might have more inflammation, more disease, bigger problems, more elaborate procedures, more complications.
It prevents us from treating you properly.
And just a quick note on the X-rays. I mean, now they changed the laws that we don't even technically have to wear the lead apron because there's no scatter radiation with our machines. We had everybody come in and check our machines. So we would still use them, of course, to make a patient feel comfortable, but we don't even need them anymore. So we don't get the scatter radiation.
Digital X-rays have significantly reduced the exposure.
And we don't need them all the time, but you need a baseline full set of X-rays, and then we can compare down the road. It's very important to check the bone, check the tartar, and it helps me. It shows me where the calculus is. And to recheck after, make sure I've done my job and really got in there. It's a tool that we use in dentistry. Very important.
One last thing I mentioned to you earlier in the week. We talk a lot about our sleep, and Mark and I say we're obsessive about our sleep, right? Are you obsessed? You obsessed a little bit?
86 last night.
I'm in the 90s. I got in the 90s last night.
No, you didn't.
I'll show you. I did. I'll tell you why. Oh, thanks. I'll take it.
I'm gonna look right now. Yeah, if I don't get a great sleep score.
For my wife's birthday, I bought her something so not romantic, but a thing called 8 Sleep. 8 Sleep, and it's something I think that people who have a really hard time sleeping should look into this. I'm blown away by this product. It's a mattress cover that has 2 different sides of control, and it's like a water flow that helps to circulate temperature. So it controls the temperature, and it has an incredible app and sensors in it that the temperature changes independently for each side throughout the night. So it'll start out at one temperature, get a little cooler, then get a little warmer. I won't get into that too much, but it's really incredible product because, my wife would complain about getting hot during the night.
And you would be cold on the other side.
Well, then it's there. Then it's difficult because what is the room set on? Blanket, sheet, all the above. This way, I got that for her because she would complain a lot and it would affect her sleep. She'd wake up hot, in the middle of the night. So I got it for her, not realizing that I love this product. It's actually we've been using it for a few weeks now, and it for some reason it actually really has helped me in my deep sleep. It's quite incredible, helping to control.
So it's 2 separate pads on either side of the bed?
It's one pad with two controls. With 2 different controls. So they have a very nice app that you each set up your profile, and we can I can see both. I can see hers and mine, and vice versa. And you can control it independently during the night. And so it kind of cools you down during the night. And kind of right before you wake up, it warms you up. And I have to say, like, the last hour of my sleep has been incredible. And it wakes me up in a way. It's like beautiful. It's beautiful. It's incredible how I feel. I feel different because you wake up in this warmth. And there's something about that. I don't know. I have to understand that more physiologically, why that matters. But it's actually really wonderful. It's not the cheapest product. There's some discount codes and such, like with some podcasters like Lex Freeman and Huberman, all these people. If you Google, you can find a discount code for a couple $100s. But it's something that if someone who's dealing with their sleep and trying to optimize it, I think it's wonderful. It's great.
Sleep is so important for health.
It's another thing. Temperature matters.
Temperature matters, and different stages of your life. You have different temperatures, and you go to sleep.
Yeah, the two things that you and I obsess about, work so hard on, is our sleep and our exercising.
We could dive into that one session and talk to our patients about that, how we monitor our sleep scores. And there's a lot of devices on the market now.
Let's do that next month. We'll talk about that a little bit next month. I was talking with a patient yesterday about it too, who's having a problem with some issues. And I'm like, well, what are you doing with your sleep? Because that's the foundation of your inflammation, foundation of your mood and your health. It's all happening while you sleep. So if you're not optimizing that, everything else you do is smaller, right? Okay, well, I'm drinking this drink. You're taking this supplement. Well, that's less than 10%, where sleep is such a large percentage. Sleep and exercise is 90-something%, right? A supplement, nutrition, you have to eat, you eat a well-balanced diet and take the right supplements for you. But those supplements are definitely less than 10% of your overall health they contribute, where your sleep and exrise is going to be 90-something% of your health probably, right?
And then if you get good sleep, you can do good exercise too in the morning. You feel better.
All right, great. Well, let us know what questions you have around this, please, or any other topics you'd like us to address in our future OMD Talks. Thanks, Chris, for everything, being with us.
Thanks, Kristin.
You're welcome.
Thanks for your time.
All right. Bye.